this session, I'm going to be talking you through some of the common treatments for insomnia, some or many of which you may currently be using or have tried in the past. Now, research shows that for those of us who have experienced extended periods of interrupted sleep, most will eventually seek out some form of help for insomnia. Now, this may be by visiting a physician, doing your own research online for solutions, and then there are others who just simply tough it out, hoping that the condition will pass. We find that most people, including myself, have tried multiple treatments, and we often utilise a variety of things at the same time. For me, that currently involves screen-free time, about an hour before I go to bed. I also drink sleepy time tea in the lead up to my bedtime. To the best that I can, I set myself a routine time that I actually go to bed each night. And I use a weighted blanket as a sensory stimulus to encourage sleep. Now, I'm going to be sharing a range of treatments so that you can make informed decisions about your healthcare and enjoy your life to the fullest. Many physicians' first recommendation is for a prescription pharmaceutical, and there is a wide array. So some common ones are sedatives, benzodiazepines, or benzos as they're often called. They tend to be prescribed if you wake up through the night and have trouble going back to sleep, and they do tend to help you fall asleep and stay asleep. But they are recommended for short-term use only. And some common medications in this category are Valium, Xanax, or diazepam. They're known for dependence and they're known for daytime grogginess. So just be mindful of some of the side effects. Now, there's also non-benzodiazepines. This category help you to go to sleep quickly. They're less addictive than benzodiazepines, and Ambien is a well-known example. Then you have your antidepressant range. Trazodone, Elavil, Doxepin, they're all common drugs. And there's also a range of non-prescription sleep aids. And some of the more common ones, some of which you're probably familiar with, are melatonin. There's Nitol, Simply Sleep, valerian root, chamomile, sleepy time tea, hops, passion flower, kava root, which you brew as a tea or you can drink as a tincture. There's 5-HTP, and a wide range of essential oils such as lavender, ylang-ylang, sandalwood, cedarwood, marjoram, and bergamot. There are also psychological interventions. Now, though these treatments are potentially among the most effective for dealing with insomnia, in practice they often fall short, and this is due to the high degree of interaction and effort required on an ongoing basis. In general, they target aspects of the mind such as thinking patterns, anxiety, identifying contributing behaviours for change, and reframing what's happening in the brain. The majority of programs use the tools of cognitive behavioural therapy, or you may know that as CBT. Other programs focus on mindfulness techniques, relaxation training, self-hypnosis skills, biofeedback, and others neuro-linguistic programming. Other common remedies and recommendations to assist restful sleep include things like touch, and that could be massage, weighted blankets, which I spoke about a little earlier on as a sensory stimulus to encourage sleep, acupuncture, a yoga practice, meditation, exercise, although vigorous exercise just before bed can be counterproductive. Taking stimulants out of your diet is a really effective, helpful way to avoid not being able to sleep, and that's things like your caffeine, your alcohol, nicotine and sugar. We want them out of your diet. Changing your sleep environment, and that can be things like controlling for factors such as light or noise and temperature. And the goal there is to be sure that it's really conducive for high quality sleep. Again, it's not uncommon for people to incorporate a range of strategies at the same time, and it can come with mixed results. So in my case, through the years I've experimented with kava, melatonin, sleepy time tea, heavy exercise through the day, getting rid of stimulants, using a cannabis tincture, going to bed earlier, going to bed later, eliminating sugar from my diet, and generally trying to reduce factors that cause stress in my life. And, while I've experienced varying degrees of short-term success through these efforts, I've learned a simple truth regarding insomnia. The key to long-term solution is finding the treatment or combination of treatments that's effective for the type of insomnia that you have. And at the same time, working towards discovering and eliminating the root cause of the insomnia. So join me for the last topic in this series, in which we're going to talk about cannabis as a wonderful treatment option for insomnia.